Wow, that was a bit of a marathon so far, huh? Thank you for still being here. As there was a comic who once said, if I knew I was going to live this long, I would have taken better care of myself. I stand here before you as a representative for the Florida Naturopathic Physicians Association. I'm here today to not ask for money, but ask for support and your awareness of who we are and what we hope to bring back to Florida. We have actually been here as a present in Florida since 1935. We've been legal to practice naturopathic medicine. For those who don't know what that is, it is a holistic, integrative healthcare approach. We're not looking to rule anybody out, but to include everybody. And so what we want to offer, and one of our premises and principles of practicing naturopathic medicine, is prevention. We feel like it is more cost-effective and beneficial for patients to actually prevent disease rather than always have to treat it. In doing so, I give you a quick little definition, my own definition of what is naturopathic medicine. It is the bridge between the knowledge of science and the wisdom of nature. For this, what we do is we integrate these kind of health cares into our practice. Except we can't practice in Florida. Our ability to practice in Florida was removed in 1958. And as many of you may know at this point, because it was stated a couple times today, where the number of people moving to Florida is somewhere around 250 to 300,000 people a year, which leads us to somewhere between 20 and 30,000 primary care physicians shortages. We hope to fulfill on some of those. We have a lot of people who would like to move here, who would like to practice here in the state of Florida, but they can't because we're not licensed. So we do have representation in the House and the Senate. We don't have a bill number just yet. We had one last year, but Representative David Smith and Senator Rodriguez will be carrying the bill and presenting it. But what I'm here today to do is to ask you to just be aware of who we are, what we stand to represent, and how we can benefit the people of Florida in our healthcare offerings. Again, what we're really wanting to do is to provide a way for people to have access to better healthcare. And again, our method of operation is let's do prevention. Let's do holistic healthcare. So I'm also referred to as what is called a vitalistic naturopathic doctor. What that means is you can get vitamin D in a bottle, or we live in the Sunshine State. I would actually prescribe for you to go outside after our session is complete and get some vitamin D. And this would be one of the things that I could prescribe as well. So again, all I'm asking for is for you to be aware of who we are, what we do, and when our bill comes up in March in Tallahassee, that you have a voice, that we carry that voice for the sake of the people in Florida. Thanks for your time.
Thank you so much. Any questions, members?
Yes.
Seeing none,
Yes.
Representatives Kinmore.
Thank you, Mr. Chair, and thank you. I'm sure I must have heard the bill if it was on a committee agenda last session.
Sure.
Can you give me briefly, I know because everyone's tired, what does the bill do, and what is the licensure that was taken away in the 50s? Can you explain that just briefly?
Yeah, in brief, I don't have all the specifics at the top of my fingers, but we had licensure. We had an ability to practice here in the state. Not only was our licensure revoked in 1958, but also it became illegal to practice naturopathic medicine in Florida. As it stands right now, there are 28 states in the country, including the District of Columbia, who do license us. We are primary care physicians. We go to 4 or 5 years of medical school post a Bachelor of Science. The challenge with our bill was that we're working out some of the details with local other medical professions, and there's just a matter of ironing out a couple of wrinkles, but it looks very promising to be moving forward.
Thank you, Mr. Chair.
Thank you so much.
Thank you so much.